All right, so we'll return to Kumasi shortly for the question and answer session. Ohiminteria is there for us. He will also join us with some more updates just on the parts where we missed. But of course, Dr. Oheniba Owusu-Danso says as far as PPEs are concerned, the Konfanoche Teaching Hospital has no shortage. However, he thinks that the call for more PPEs is in order. And of course, the GMA in that direction has been very vociferous, calling for more protective gears for the frontline health workers. He was excited and thanked the president for the packages announced yesterday. And we know that there's an insurance package of 350,000 for each frontline health worker. And this is to deal with cases of death or ailments or even deformities, as announced earlier by the Health Minister Kweku Agyeman-Menu. And we also know that he's been admonishing that you stay healthy, you eat a lot of vegetables and a lot of fruits. You need that to boost your immune system. We'll be heading back to Kumasi to join my colleague Ohiminteria to give us some more. We have the director of KCCR addressing the media now. Let's head back there.
KCCR has been with us for 23 years, if I should let you know. It was set up so that we'll provide facilities in the Middle Belt for such a time as this. 23 years ago, we did not think that there will be a pandemic that will require our services. But now we've seen that the services are really needed. And so if you come to KCCR, we have laboratories that can perform sophisticated investigations similar to what Noguchi in Accra is able to do. So previously, diagnostics that could not be done locally, we can do them all in our facility. So when you have the opportunity, you can come to campus and we'll be able to show you what is in these facilities. With respect to COVID-19 diagnostics, you require special facilities to get these diagnostics done. You need, for the molecular diagnostics or to find the genetic material for the virus, you need 3 separate laboratories so that you don't contaminate yourself and provide wrong results. So if you come to KCCR, just as in Noguchi, we have 3 separate rooms where these tests are done. And we have equipment that are not ordinarily available in our health facilities to do this. In addition to that, sometimes I hear in the media, expand diagnostics and to everywhere. But remember that the virus we are dealing with is a dangerous organism. And so when you are working with dangerous organisms, you need to work in special laboratories. So we have what we call biosafety laboratories. And these laboratories have negative pressure in the room so that when you are working, you can work safely. You have special cabinets that you work in, and you wear all your PPEs. And when you come out, you have to dispose of them. Anytime you are going, you need to put them on again. And so with such biosafety laboratories, there are not many in this country. And that is why really Noguchi is able to do it and KCCR is able to do it. And it's the same facilities you use in processing TB cultures. And so if you come to KCCR, the same laboratory processes TB cultures for several regions. So this test for COVID-19, we set it up in February, and we received the first sample for processing on the 29th of February. And we started churning out results. These results have covered Ashanti, Bono, Ahafo, Bono East, Northern, Northeast, Upper East, Upper West, Savannah, some bits of the Central that have easy access to Kumasi. We are getting samples from all over, although the majority are coming from the Ashanti region. Currently, we've processed more than 1,600 samples, and we have a backlog of about 500 that we are processing today. And out of that, you know that we have 24 positives, not only from the Ashanti region, but also the ones that came from the Upper East, Upper West, Northern Region, they all came from KCCR. So currently, because of the inflow of samples, I mean, really, we have capacity to process about 300 to 600 samples every day. And we've sort of ramped up our work. We have a dedicated team working 24/7. Some run daily shifts and some run night shifts, and we roll it over and over since the sample numbers started going up. So that is what we've been doing, and we see that it is really key for this control, for the control of COVID-19, because we need to provide the diagnostics for the case management to make sure that as the patient enters the facilities in the hospital,
And that's the director of the KCCR, that's the Kumasi Center for Collaborative Research, Dr. Richard Phillips, giving us an update on their preparedness and also how they are offering their services. And this time, they have the capacity, as you heard him tell us a while ago, to process 300 to 600 samples. Let's go back there to Kumasi. Well, we seem to be having some challenges there. Once the feed is clear, we'll return to Kumasi and hear more from Dr. Richard Phillips, who is the director of the KCCR. And he mentioned that now they've had to adjust their schedule. So they're working 24/7 with some doing a night shift so they can render their services to the nation in this very crucial moment. They are able to process 300 to 600 samples on a daily basis. Professor Richard is back on the field.
The facility. The Ghana Health Service is looking at how to possibly using drones to deliver the samples onto campus, and that will be innovative, and especially for those that have difficulty in bringing the samples directly to the center. So you need to first collect the sample. The second stage when you receive is that you need to make sure that you extract the molecular or genetic material for the virus. And so you need specific kits for doing that. After you've done that, you need another kit to amplify or make the virus detected. And that process too requires a separate kit. So far, we've received kits. Initially, when we started, we received donations from Berlin, and from the Charité Institute in Berlin, and also from our partners in the Bernard-Nocht Institute of Tropical Medicine. Subsequently, we've received some of the JACMA donation of test kits, and that's about 4,800. And we've also received 750 RNA or genetic material extraction kits that we are currently using. And so currently, I think we are well set up, and we are committed to providing diagnostics on time. And we know how the clinical scenario looks like, so we know the rapidity with which we need to provide these resources and these results. And so we are doing very well to provide that. We are looking at various things on how to probably expand the laboratory setting to maybe Tamale and Navrongo, and to provide oversight for them so that their travel time is shortened. And so we are in discussion with the Ghana Health Service to be able to provide that. And we think that will reduce their stress in bringing the samples to the south. So I think we are very grateful to you for giving us this opportunity to provide this update, and we are keen to continue collaborating with all the stakeholders to providing the needed diagnostics until the outbreak subsides. Thank you very much.
Professor Philip Richards is the director of the KCCR, that's the Kumasi Center for Collaborative Research. And one very important issue he touched on is about the setting up of a center in Tamale and Navrongo, because as it stands, all samples from the northern part of the country are brought down to Kumasi for testing. And as we speak, he says they have a backlog of about 500 samples to test. Already they have done 1,600 samples, and they are only able to test a maximum of 600 samples. And so that should tell you the challenge there. They're looking to setting up these centers in Tamale and Navungo so they could provide some oversight and help test more cases as and when we have them coming. Let's go back. There's a question and answer session, and I will get some more information from that.
Kumasi Center for Collaborative Research. Say your KNUST campus bra Kumasi Center for Collaborative Research no na yanje ndi say yebenya yare bia eto te say COVID-19 yenhu na yanje ndi nso say yenhu beba mfaso say ba ya adwene a yede ye ne say yebetumi apɛ infidie akukudan a sɛ yɛpɛsɛ yɛhwehwɛ yare a and normal sɛ yɛntumi ɛnyɛ wɔ yɛman mu a yɛbɛtumi ayɛ ɛwɔ asanteman mu ɛne baabia a ɛtwa yɛn ho ahyia enti sɛsɛ no yɛwɔ mfidie ahodoɔ a sɛ woba yɛ center hɔ a ɛtumi yɛ saa COVID-19 no ho adwuma sɛnea meka no February no mu ɛna yɛte sɛ COVID-19 no ahyɛ ase na yɛpɛ ho diagnosis no ebi nti yehu sɛ yɛ adwuma no yehu sɛ ba se yɛde wɔn ayadefoɔ samples ba yɛbɛtumi ayɛ ho adwuma nso yie nti 29 February ɛne yɛnsa ka sample edi kan efi yayaresabea ne bia atwa yɛn ho ahyia na ɛno akyi no samples no ba na ɛba me di say ya patient sample bɛyɛ 1,600 echo 2,000 and no pay me share number ne ye ba me gidi di say ye do 2,000 edada enti yeguso a ye kwa yeguso provide provide sa diagnosis senia a doctor fo a omo ye patient ho adwuma e wo ye hospitals no mo benya reports no in terms so no matumi e de ahwe yayarefo no omu hia ne ntem efi say esese omu hu ba bia om de yarefo no ebeto eni nnuro ahodo a esese ye de ma patient na ye nso ye tie no as so ye tie ase bi eno so nti ye adwuma day and night se ne be ya ye betumi anya resource no ntem so e de ama omo se ne omo de be ye adwuma nti ya ni eguso ye koda bia ye nya kra mi di say 500 and over samples de ye nya a che say yeguso a ye koda bia ye na esa na ye di bi ka ho ba yeguso a ye ni ejidi say se eto aso ya ebeboa ama yetumi aye COVID-19 ho adwuma eyie na meka bibi kakra afa diagnosis na say nhwehwemu na ye no ho impembebre ya nipa metese nipa ka say oh sab me kura mitumi ye diagnosis bi enye mo a utumi koye no ho adwuma saa kwa efi say ye fa ne say oya abo a ne ho ye hu ana ye dangerous che say ukoye no ho adwuma wo ba bia emfata wanhwe ya wankasa obetumi anya saa yare ni bi nti uhia edan a ebebo wo ho ban se ukomu na ukoye mwan ho adwuma wankasa wonkopetu nya bi na eno no ye obi wo ye ho ebi nso wo noguchi eno nso nti ena noguchi ene ye di kan a ye saa diagnosis ho adwuma ekopem bra ye betumi anya more facilities a omutumi eye saa adwuma safely an idea ne say ye be ma nkofo aye mo anu ho adwuma safely sanya ne oye ho adwuma no onkonya bi enti impembebe no ni ayeye ne say ye de nia o de befa sample no ekoma hospitals no na omo afa sample no no omo de abrain omo hyehyɛ ne pepepe omo okwan omo hyehyɛ no se ne ebe ya omo de sample no ba no so omo nkonya yare ni bi omo ba ye de kɔhyɛ dan specific dan bi mu a ye frɛ no biosafety laboratory ansa na yakako bie adaka no so ana ya hwa de kokra e sha adaka because okoye no ho adwuma wa abonten a wan hwa no aka konya bi nti ye make sure say ye be follow rules no se ne be ya mo wan ye ho adwuma no so ma ye adwuma ni safely wo ye wi a ese se wo san ye nhwehwemu ahodo kopem bra wo betumi anya wo benya idea no se aboa na wo ye ho adwuma no wo ho e
Apologies for that break in the feed there. That is Dr. Phillips, Richard Phillips, Director of the KCCR, giving us an update, doing that in Tree for the audience in Tree as well. But what he said so far is that the KCCR is in a position to test samples a maximum of 2,000. So far they have done, that is 2,000. But on a daily basis, they're able to test a maximum of 600 cases. And like he did mention, they have a backlog of about 500. Now, he's also been speaking about the need for, a contact tracing and for a mass testing. He says that is very dangerous because as it stands now, there's no need for that. And because of the nature of the virus, we have to be careful before making such moves. We'll head back to Kumasi. There's supposed to be a question and answer session. We're not sure if that will happen soon, but once we have that, we'll bring that to you. Our colleague Owusu-Danso is there. He will join us shortly to bring us some more updates on what we missed from that news briefing at Kumasi. Earlier, we heard from the CEO of the Konfanoche Teaching Hospital, that's Dr. Owusu-Danso, who told us about what CAT is doing so far to deal with COVID-19. They have a 24-bed facility in 2 ICUs prepared to handle cases if there are any. As it stands now, just 1 patient, which they were handling, has been discharged home for home care. Initially, the second test proved positive. Then there was a final one that proved negative, and that it was upon that results she was discharged home for home care. He has made it clear that officials from the hospital will be visiting her regularly to check on her and to make sure that she recovers completely. Of course, the admonition to adhere to the social distancing rules still stands, and also to eat well, rest, and make sure that you're healthy so your immune system is robust to deal with a case in the event that you come into contact with the virus or you test positive for that. And Dr. Owusu-Danso was grateful to government. We know that they have some tax holidays for 3 months. The president announced that yesterday. And so they are grateful to the president for this. For him, as a manager of a health facility, it comes in very handy because it serves as motivation and adds up to the work they're doing to motivate their staff, the frontline health workers who are putting themselves out there, putting their lives on the line to make sure that you and I are safe. And so it is important that you stay home. If it is possible, as much as you can, stay home, observe the protocols, respect the directives, and make sure that you also observe social distancing. Wash your hands as much as possible, avoid touching your face, and use your hand sanitizers. And you can make use of mobile phones, technology, to assess whatever that you need to do. We'll be heading back to Kumasi. And also very important, we know that the issue of PPEs has become very important for health workers in some areas across the country, complaining about the shortage, even for the people who are doing contact tracing. And one very important thing to note also is that 400,000 people have been released for contact tracing. That was made known by the Director for Health for the Ashanti region. That's it for now. Apologies we couldn't bring you Joy News Interactive, but you can always drop your comments on our social media platforms, on Facebook, on Twitter and Instagram. We'll read that to you. We'll share that with the rest of the world in our subsequent bulletins. Many thanks for your company. There's more news when you log on to myjoyonline.com, and Joy News today comes up with Daniel Dazi at midday. Stay with us.